My name is Tia, and I'm going to conduct your physical exam today. How are you doing?
Good.
Perfect. Do you have any areas of concern, any tenderness or pain in your body before we begin?
No.
All right. So first we're just going to start by doing a quick head to toe, just a physical overview, assessing general appearance. My patient, oh, also, are you 21 plus?
Yes.
All right. Just wanted to get that out the way. But my patient appears normal, not normal, but well nourished and has appears well hydrated. I'm just gonna take a look and first inspect your skin, assessing for any lesions or abnormalities, which I don't notice. Then I'm just gonna feel your skin, palpate, assessing the temperature. The skin temperature feels warm, soft. The skin is hydrated, moisturized. We have elastic skin turgor. And then I'm going to take a look at your fingertips. I'm going to assess the fingertip and the nail bed. I'm going to inspect for capillary refill. Capillary refill is brisk. Again, noting no clubbing on the fingernails. All right, thank you. Then I'm going to take a look at your hair. So first I'm inspecting the head in its totality. I'm inspecting for symmetry, and then I'm also just looking into the scalp as well. I'm taking apart the hair. I feel the hair is, it's in braids, but the hair is clean, coarse, no knits in the hair. The hair is nice and clean. At the scalp, I'm just gonna palpate for any tenderness. Any tenderness notified?
No.
Okay. All right. So that looks great. Then I'm gonna again inspect the face. I'll have you look at me. First, I'm gonna inspect your eyes and your eyebrows and your eyelids. I'm inspecting for symmetry or any abnormalities noted, none noted. Then I'm looking into your eyes, just looking into the lacrimal glands. They're moist. Your no cracking, no issues noted within the eyes. Then I'm looking down into just inspecting the face. So I'm inspecting your cheekbones and your nose and your lips, just first on the visual aspect. Face looks linear and symmetrical on both sides. So then next I'm going to do a full assessment on the eyes. So first I'm going to dim the lights, and then we're going to do a fundoscopic exam. When I dim the lights, all right, so first I'm going to stand about 10 feet away from my patient. And first, do you have any visual abnormalities or any problems with your vision?
No.
Okay. Do you wear glasses or corrective lenses?
No.
All right. So first, I'm going to shine the light into your eyes, and I'm going to assess that your pupils are accommodating to the light. I'm going to assess the size of your pupils using the pupil chart, and then we're going to go from there on the assessment. So standing about 10 feet away from my patient, I'm going to first shine the light in the left eye, looking straight, and then I'm going to shine the light in the right eye, assessing for constriction, pupil dilation, constriction, and then I'm also going to assess the accommodation. So the pupils are about a 2, round, reactive, equal, and there's accommodation to light. I'm noticing looking straight ahead. I'm noticing the red light reflex in the eyes. No papillary edema. No issues with the vision. I'm going to turn on the light. Okay. Now to continue with the eye exam. All right. I'm going to have you, just wanted to make sure you can see what is being done visually. I'm going to have you first, we're going to assess the visual confrontation, and also we're going to assess the visual confrontation first. Actually, you're gonna let me know when you can see the peripherally. So when you see my hands wiggling, let me know.
See it.
Looking straight ahead. When you see my hands wiggling, let me know.
I see it.
Perfect. And then we're gonna assess your consensual vision by having you stare at the pen as it goes towards your face, and I'm assessing that your eyes are inverted into your nose, like in your inward, so that they're going towards your nose. Perfect. All right, and then I'm going to have you follow the pen with a large H shape, and we're going to assess the extraocular movements, the lateral gazes, upwards, lowers, and then we're going to assess for any strabismus or any extraocular movements or regular movements. So just follow the pen with your eyes. Going to go all the way to the left, back into the middle, all the way to the right laterally, up, vertically, down, and then back towards the middle. Perfect. Okay, and then next we're gonna assess Next we're gonna assess your nose. So first I'm just doing the visual inspecting. I'm also gonna feel your face and assess the glands for any tenderness. Do you have any tenderness?
No.
All right, and then I'm gonna look in just for visual. Yep. No, and I'm going to assess for any septal deviation. Do you have any drainage?
No.
Nope. Septum looks midline. No deviation noted. No lesions noted. No extra drainage. And then we're gonna assess your lips and the oral cavity. So first, lips looks hydrated, not and they look symmetrical. Lips are intact, nice and moist and pink. I'll have you using the tongue depressor, which I would put in the inside of her mouth, and then I'm gonna have you say ah. Yep, pressing down, checking that the uvula rises. And then I'm also, upon inspection of the tongue, I'll have you stick out your tongue, that it protrudes midline. The tongue is nice and pink, moist, intact. Okay, thank you. And then just say cheese.
Cheese.
Smile is linear, midline, even, symmetry noted. Okay, now moving right along, we're gonna check the ears. Okay. So I just have the light ready, but first we're just going to do a visual inspection. First we're going to inspect the ears and the ear canal. We're going to inspect for any redness, any extra drainage. How's your vision?
Good.
Or how's your hearing as well?
Good.
All right, perfect. I'm going to just palpate on the tragus and palpate on the mastoid bone. And then I noticed she does have ear piercings, but those look well healed, no issues. And then we're gonna look inside. And then because I'm going in the right ear, we're gonna go at 5 o'clock. And then in the right ear, you'll notice the cone of light, which is like a pearly gray light, translucent. There's no exudate in the ear. There's no cerumen, no occlusions. Then we're gonna do the whisper test. So I'm going to stand about 5 feet, and I'm going to whisper something in the patient's ear, and then the patient will let me know what I say.
Hello.
All right, and then I would do the same thing on the other ear, and I would say goodbye.
Goodbye.
All right, and that will be on the other ear. So that would just assess the hearing bilaterally. All right, so the next thing we're going to assess is the neck. So first we're just going to do a visual inspection. Can you look up for me? Thank you. Just inspect for that first, if there's any abnormality. So first I'm inspecting for symmetry and that the trachea is midline. I'm also inspecting the thyroid. So I'm inspecting that there's no tenderness or swollenness or pain in the thyroid area. Have you noticed any problems with that? Do you have any problems with swallowing?
No.
Any problems with weight change or heat intolerance?
No.
All right. Then I'm going to assess on the back side. And I'm also going to inspect the neck for any swollenness and tenderness or any issues in the back side. And I'll have you swallow, assessing that the area goes up and then down. Okay. Then moving right along, we're going to then inspect the cardiac system. So I'll have you lie down. And for optimal visualization, I will be on this side. Okay, so the first thing that we do is inspect always. So first, I'm inspecting the areas of the heart that we will then examine. So first, I'm just gonna palpate over the areas. So second intercostal, right, then left, and we'll go through this again, but just first doing a slight palpation around that cavity where the heart lies, and then we'll go through and listen with our stethoscope. We'll listen with the bell side. So the first thing we'll listen, right second intercostal space is you're gonna assess the aortic valve, and that's gonna assess for any murmurs. You're gonna listen for that S1 and S2, and then next you're gonna listen on the left side into second intercostal space. You're gonna listen for the pulmonic. All right, and then third intercostal space, you're gonna go left. You're gonna go check the herbs point. And then fourth intercostal space on the left, you're gonna listen for the tricuspid murmurs, or in the tricuspid area for any murmurs. And then fifth intercostal space, which is also the apex, which is the apical point of the heart. So I'd have the patient lean on their left side. I won't do that because then you won't be able to see where I'm visualizing, but I'd have the patient roll on their left side, listen for 15 seconds. All right, so my 15 seconds would conclude the heart rate is about 65, normal rate, rhythm noted. And then also I'm going to assess the neck. So first I'm going to just look at the neck, and then I'm going to assess the jugular vein. So I'm going to first palpate in the sternal, in the anterior sternal mastoid area, deep. And then I'm gonna have the patient hold their breath while I auscultate with the bell for the bruit heard. So again, that's on this area on the neck. I'm gonna have the patient hold their breath for 15 seconds and then hear the whoosh sound, which is the bruit noted. All right, so then after listening to the heart, I'm going to then assess the pulses, so the peripheral system. So first I'm just inspecting the skin on the legs. I'm inspecting, so the skin is within normal limits, nice, warm, appropriate for ethnicity, no swelling, no edema, no redness, like just the skin looks appropriate and normal throughout, normal hair distribution, warm temperature, soft skin. And then I assess the pulses bilaterally. Pulses are strong, bounding. The pedal pulses at the top of the foot, the posterior pulses, tibial pulses in the inside of the ankles, the popliteal pulses behind the knees. And then again, I assess bilaterally, but just showing this is the radial pulse, which is following the thumb on the wrist side. And then again, the brachial pulse is in the antecubital area. Perfect, thank you. Now I'll have you sit up. And then also the last pulses that we can visualize, but I won't assess, are the femoral pulses, which are noted to be here, nice and strong in the inner groin area. Perfect. So then the next thing I'm going to do is just jumping back to the neck exam. We just have to go through all the cervical lymph nodes. So first we're going to do the submental. That one's under the chin. And then we'll do the submandibular. And then we're going to do the preauricular in front of the ears. And then we're going to do the postauricular behind the ears. Occipital behind the head. And then we're going to do the anterior superficial or superior, in the front here. And then we're going to do the posterior cervical in the back, deep in the and then the deep chains in the sternal-mastoid, again behind the neck. Also the tonsillar underneath the mastoid bone, and then these ones are important to note, the supraclavicular. Okay. Just making sure I touched upon all the important ones. All right, and then next we'll do the last part of the exam. Just making sure we're good on time. Perfect. Then for the last part of the exam, we're going to do the thoracic. So first, I'm just going to visually inspect your chest. Do you have any problems with breathing? Any troubles breathing? Any trouble lying flat breathing? Shortness of breath walking up the stairs? Asthma?
No.
Cough?
Mm-mm.
All right. So first, we're just going to do a physical, just a visual inspection in the front and the back. So first, I'm going to visualize the front. Again, visualize that you have equal chest expansion, noticing the appearance and silhouette of the chest. And then I'm going to do the same thing on the back side. Again, noting that the back of the chest has even symmetrical chest rising. I'll have you turn just so that we can visualize what we're doing. Just a little more. Perfect. Yeah. So with the open back, after looking and inspecting, we're then going to percuss. So to percuss, we're going to take our finger and then we're going to go over the lung fields. So one is going to be upper, right and left. 2, mid, right and left. 3, lower, right and left. 4, right, and then on the side, and then other side, again, over. And then for the 5th one, you're going to do the same thing. You'll percuss, and then again on the other side. So perfect. And then we're going to, again, listen. We're going to listen to the lungs, and we should have resonance over areas, shouldn't appear dull. Then we're going to take a listen. Nice deep breaths in and out. Perfect. Again, nice. We have good aeration, regular rate noted, assessing the chest expand. That's okay. So we're looking for the chest to rise, and we're looking for even expansion, assessing breathing for 15 seconds, normal rate and rhythm. The breathing rate for you is about 20 breaths per minute after assessing for 15 seconds. So we've done, and then I'm going to assess for fremitus. So I'm going to also have you say 99.
99, 99, 99, 99, 99.
Yeah. I'm assessing for any extra vibrations felt, none noted. And again, everything done to the back would be done to the front. I'd have the patient listen. I'd listen to the patient again through the front, percuss through the front, auscultate all sounds, all lung sounds. So again, regular rate, rhythm, identified for the breathing, no abnormalities noted. All right, well now this concludes our physical exam. Thank you for your time.
Thank you.
Have a nice day.
You too.